Hello everyone, my name is Abdullah and today I'm going to talk about the role of elastography in reducing the need for biopsies in breast and thyroid lesions. This is a literature review project done by Charlotte Boydger, Ann Hughes, and myself. I will start by talking about the aim of this literature review, then I will introduce elastography. After that, the methods, then discussing how elastography can reduce the number of unnecessary biopsies, and finally, the conclusion and final points. When a thyroid or breast mass discovered, either clinically, incidentally, or by a screening mammogram, the main question would be, is it malignant? Biopsy and histology has the final word, but should we biopsy every mass? Well, most masses were biopsied before discovering the scoring systems for thyroid and breast masses, which are known as TIRADS and BIRADS. These two systems categorize thyroid nodules and breast lumps into different types of categories based on certain features such as wall regularity, echogenicity, and the presence of calcification. With TIRADS and BIRADS, only suspicious masses are biopsied. But even with these systems, there are still large number of biopsies are done for benign masses. The aim of this literature review is to explore the possibility of integrating elastography with TIRADS and BIRADS, which might increase the accuracy of detecting malignant masses and therefore decreasing the number of unnecessary biopsies. So, what is elastography? According to Oxford Dictionary, the word elastography is composed of elastic, which means flexible, non-stiff, and graphy. So, the word elastography means the technique of producing images that describes the stiffness of a tissue. It evolved from the technique of external manual palpation, which is used by physicians to check the stiffness of a mass during clinical examination. From a physics perspective, the ultrasound machine calculates the stiffness by measuring strain, which is the change in tissue dimensions. There are two main types of elastography: static or strain elastography. In this method, the elastography measurement achieved by applying external force by the sonographer or endogenous force such as a pulsating artery or patient respiration. It involves imaging the area of interest before and after compression has been applied. Tissue stiffness is shown on a color image, where blue is often stiffer and red indicates softer tissue. This image here on the left side illustrates a typical elastogram over a grayscale B-mode ultrasound image, where red areas are stiffer than blue areas. The other type is the more common dynamic or strain elastography. This type uses an acoustic force generated by the ultrasound system. This force creates shear waves, as shown here in this image in here. These shear waves created along the sides of the tissue being examined. Speeds of these waves are calculated and used to estimate the density and stiffness of the tissue. The stiffer the tissue, the higher the speed of the shear waves. Because stiffer masses are more likely to be malignant, elastography used to determine the likelihood of malignancy in thyroid and breast masses. There are other types as well, such as assessing tissue fibrosis in liver and kidneys. Elastography has some drawbacks, such as being highly operator dependent, especially with the static type. Moreover, prolonged pressure increases the stiffness in surrounding tissues, which leads to inaccurate results. The authors find these limitations to be outweighed by the benefits of limiting invasive and expensive procedures, instant results, and a great region of tissue examined with elastography than with biopsy. Let's talk about methods. The research databases used in this literature review includes UpToDate, PubMed, and Ovid. Articles relating to elastography ultrasounds are also used. Keywords include elastography, breast, thyroid, TIRADS, BIRADS, and biopsy. The first part of discussion is about integrating elastography with thyroids and how it can modify thyroid nodules categories. Nowadays, thyroid is used to categorize thyroid nodules into benign and malignant. Some research show promising results by integrating elastography with thyroids. For example, this figure is from a research done by Yang et al., and it illustrates how elastography can accurately detect malignancy and modify the thyroid's grade of thyroid nodules. Each of these three nodules in these three figures labeled A, B, and C have been either downgraded or upgraded, and the histology confirmed the accuracy of elastography. In figure A and B, elastography upgraded the thyroid scoring of the thyroid nodules, and histology confirmed that the nodules are papillary carcinoma in both types. In figure C, the opposite happened. Elastography downgraded this nodule from thyroid 4A into thyroid 3, and histology confirmed that this is a benign nodule goiter. This proves that stiffness measurements, when added to thyroid grading, can increase the accuracy of malignancy detection and thus reduce the number of unnecessary biopsies. Now we are going to discuss how elastography can modify breast lumps thyroid grading. It is common practice to biopsy thyroids 4A, 4B, and 4C lesions. Cole et al. Suggested that addition of strain elastography could help downgrade thyroid's category 4A lesions detected on ultrasound. And a study done by Evans et al. Suggesting that it may be safe to follow up with ultrasound for 4A lesions with soft elastography, but still necessary to biopsy 4A lesions with not soft elastography. This table shows that in average risk patients that have soft elastography, 4A lesions only 1.5% were malignant, while 98.5% were benign. Ultrasound follow-up may be a useful tool for patients that fit in this specific category. In conclusion, elastography is a useful tool in determining the stiffness of a tissue using manual or shear wave compression techniques. This can be used as a complementary source of determining if a mass is benign or malignant in combination with B-mode imaging using the thyroids for thyroid nodules and biroids for breast lumps. Further studies will add to the data that elastography measurements when added to thyroids and biroids criteria can reduce the number of unnecessary biopsies and breast biopsies. Thank you.